Good afternoon, everyone, and welcome to NASTAC's April webinar. Welcome the Father, Strengthening Father Inclusive Practices. I'm Gail Cormier, the Project Director of NASTAC, the Family Center of Excellence. Before we get started on our presentation today, I would like to go over a few housekeeping items. Today's webinar is being recorded. The recording, along with the PowerPoint presentations, slides, and any additional resources, will be uploaded on our events page after the presentation. All attendees will be muted for the presentation portion of today's webinar. However, we will still look forward to hearing your questions, and we are happy to help you with any technical issues you may have. To ask a question or request TA while the presentation is going on, please send a message in the chat box. We will be watching the chat during the entire presentation. After the presentation, we will unmute and you will have the opportunity to ask questions. And we really want you to be vocal. So take your mute buttons off, put your cameras on, and join the conversation. We'd ask if it will help us if you raise your hand on the hand button. When you leave this webinar, you'll be redirected to complete a short feedback survey using the link provided. This survey will help us continuously improve our webinars, and it also fulfills our SAMHSA obligation to provide them with important data required by our contract. Please note, all information will be confidential, and we will respect your privacy. We do not offer CEU credits for our webinars, but you will receive a certificate of attendance immediately after you fill out the survey. I would like to thank SAMHSA for allowing us to share this information with you today. And again, thank you for joining us. NASTAC uses family-driven language, and as you can see, we like to be trauma responsive, strengths-based, avoids blaming caregivers. We want to be inclusive. We always use person-first language. We want to be respectful, non-judgmental, and consistent with our actions. Next slide. It is now my honor to turn this webinar over to the Commonwealth Center of Fathers and Families. The team will introduce themselves. Thank you.
Thank you, Sister Gail. Thank each one of you that are here. Thank you from around the globe, literally. My name is David Cozart. I am the Chief Visionary Officer for the Commonwealth Center for Fathers and Families. And I'll be somewhat of a facilitator moderator today. I'll be sharing some information as you see in the overview and objectives here. The first segment we'll be talking about what's the big deal about fathers? Why fathers, right? And then segment 2, you're going to hear from one of our lived experience colleagues to talk about fatherhood through his narrative and through some of the statistics that we have given you. We'll pop back with, in segment 3, a program model, which you'll hear about the services that we do here in Kentucky through this organization, CCFF. And in segment 4, we're going to go back to another one of our colleagues that is a KY Dad Academy alum, Mr. Teray Wilson. And so you will hear more about what that KY Dad means as we go through the presentation. And I truly believe that information without application is aggravation. And so we never like to do a presentation without giving some applications that you can use where you are, again, literally around the globe. And I want to thank our sister from I think is in England, London, England, because now I can now put on my vita that I am an international presenter. And so thank you very much for that. And we will, you just made me a more robust presenter. And so fatherhood, next slide, please. Here are our objectives. We want to make sure you get some takeaways into application, but there are some specific objectives of today. Increase your knowledge about the importance of responsible fatherhood and the impact on life outcomes. That sounds like a foregone conclusion, but it really isn't. We want to clarify some principles of collective impact and systems leadership approaches. We work together and collaboratively on anything that we do. You'll hear us say, if you're doing it alone, you're doing it wrong. And I know that's a principle of the National Family Support and Technical Assistance Center and the National Federation of Families, that collaboration and group impact is a part of their principles. So we want to talk about that as well. Demonstrate statewide fatherhood engagement efforts that hold high regard for lived experiences, and that's lived experience leadership, quite frankly. So excuse the bullet mishap there. We want to resolve some myths that might be around marginalized, particularly African-American populations, that relates to fatherhood and responsible fatherhood. And then again, those practical approaches that can increase your father-centric spaces, policies, approaches, and procedures where you are doing your body of work. Next slide, please. So this is $1 million lottery question. $1 million lottery question, if somebody can tell me who this is. Next slide, very quick, because I don't have $1 million to give away. That I hope nobody answered. That gentleman that looked like a contestant on Jeopardy is Manuel Schneider. Manuel Schneider, though it seems is kind of obscure, he's relevant to us because he holds the record for the longest wheelie on a bicycle in 1 hour. He rode a wheelie for 31 kilometers nearly. That's about 19 miles that he rode a wheelie in an hour. And he achieved that back in Switzerland back in 2020. Pretty amazing. Next slide, please. Another $1 million for whoever can name this individual. Please move the slide real quickly. I don't have $1 million. I definitely don't have $2 million. That gentleman is Flip Ogana. He holds the record for the longest bike ride in an hour, and he covered 56 kilometers, almost 57, 35 miles. And that was also accomplished in Switzerland. What do bike riders have to do with fatherhood? Next slide, please. Mr. Schneider rode about 19 miles on a wheelie, you see there on your left. Mr. Flip Ogana rode almost twice as much as that, 35 miles, riding the bike on 2 wheels. The application of fatherhood here is this. Our families do what they have to do to raise their children. But I believe that the way we are raising, the way we are doing things, and through the fatherhood lens, because of fatherhood absence, we're having challenges riding the bike as far as we could because we're forced to ride on a wheelie so many times. A bike is designed to be ridden on 2 wheels. We improvise and ride on 1 wheel at times, right? So many of us are wheelie experts. Single mothers, grandparents raising children, great-grandparents raising children, children in other situations, right? Other family compositions. But if we had fathers engaged, had 2 wheels on the bike, we see that we can go a further distance. Next slide, please. So that analogy is designed to talk about how fatherhood and fathers and mothers and a holistic family constellation can better address the issues that we have to address so that we have children raised in our safest, optimal environments. And that is a display of what many of you have heard of the upstream approach. Upstream approach is going back upstream, as you know, and seeing what issues are causing those things that we're trying to address. And so what we believe is that fatherhood is an upstream issue. Fatherhood, if we can get fathers engaged in a healthy way, more often we get that bike back on two wheels, and some of the issues that we're dealing with downstream, we won't have to address as much. Next slide, please. So I always say, and you might say, in God we trust, all others bring data. Here's some data around what father absence in America looks like and some of the issues that are associated with father absence. So father absence in America looks like 18.4 million children. That's 1 in 4 households are going to have a child that's in a home absent of a father. That number, you can look at statistics now, that number is actually, you'll see a 17.2 because we're doing some work and we're seeing that number reduce. I've been around long enough, just short of 3 decades, working in this body of work called fatherhood. And it actually started off at 21.2 million. It went down to 18.4, and most recent stats are saying 17.2. So we're moving the needle, but 17.2 million children that are in compromised states is still too many children. If you break that down to our Caucasian or white, it's about 1 out of 4. That's the number they're using, that 20%. In our Hispanic population, Spanish-speaking populations across this nation, it goes up to about 1 in 3. If you distill it down to the African-American diaspora or African-American community, it looks to be about 60, some stats say up to 70%, almost 1 in 4. We'll talk about that number in just a bit, but these are the numbers we're looking at in reference to father absence in America. Next slide, please. Here are all the many issues that we know that father absence impacts. Child and family well-being. The life outcomes of children are impacted when fathers are absent. They're more likely to be in households where there is abuse or neglect if a father's absent, more than likely be in household where poverty is an issue if fathers are absent. Homelessness, teen runaways. The majority of teen runaways come from father absence homes. This is what our stats tell us. I'm giving you a snapshot here. We know that father absence impacts mental health, behavioral health, and physical health. Cognitive ability and academic achievement are impacted when fathers are absent from home. We know that children are more likely to act out in school, more likely to drop out of school, more likely to have behavioral issues in school when fathers are absent from the home. Violent crime. Children are more likely to commit a violent crime or be a victim of a violent crime when fathers are absent from the home. When you look at justice systems, incarceration, and reentry, unfortunately, fatherhood is inextricably tied with incarceration and reentry. And a youth is more likely to commit a crime and be incarcerated if a father is absent from the home. Addiction, substance use disorder, and recovery. When fathers are absent from a home, an adolescent is more likely to try and or abuse drugs when they're in father absent homes. Poverty, economic stability, 2 incomes, that's pretty logical, right? So if you have 2 incomes instead of 1, fathers and mothers, that's going to help us with the poverty issues that so many of us fight against and seek to address. Healthy relationships. When fathers are in the home, children are more likely to grow up to marry. If you come from a divorced home, the children are more likely to be divorced when they become adults. Here is the one that many people don't know about: human trafficking. Human trafficking and prostitution, quite frankly, are synonymous. And this sounds very morbid, but it's the truth. When fathers are absent from homes, they're more likely to, that young lady is more likely to be a victim of human trafficking and or prostitution. And when you think about that, it kind of makes sense, particularly when you hear some of the language that's used in that arena. After all, what do those men oftentimes, what do the women in human trafficking call the men that kind of are in control in those arenas? Interesting, right? Daddy. Maternal health, fatherhood and father presence increases the likelihood of prenatal care for the mother. It increases the likelihood of a healthy child being born reduces the likelihood of low birth weight, reduces the likelihood of morbidity during pregnancy or childhood mortalities, and mortality to mothers during birth. Postnatally, when fathers are engaged, maternal stress is reduced for the mother and the father. So what we see is fatherhood as we see it, and we want to help people know that it is one of those upstream issues, that there are many issues that we're seeking to deal with in our social services, in our human services, in the educational system, in our healthcare system, in every sector that we're working around. We could stand to do some preventive work if we were able to increase responsible fatherhood engagement. Next slide, please. So I don't want to ramble on. What we do here at CCFF is we seek to spread or propagate, is the big word for that, fatherhood across the state of Kentucky and beyond. One of the ways we do that is we have a program called KY Dad. You will see here in just a bit, more details on KY Dad. But to give you a break from my voice and to give you better knowledge and application of responsible fatherhood and the programming that we do and are seeking to spread across the nation as we can, is Tyler Barrett. I will allow Tyler to introduce himself and share some of his narrative.
Thank you, David. My name is Tyler Barrett. I'm a father of 6. I have 3 biological kids and 3 with my wife now. I'm in recovery. I spent the better part of 20 years in active addiction. Growing up, my mother and father, they divorced when I was just a baby. They didn't co-parent very well, so I was introduced to the term child support at a very young age. I looked at it kind of like, and it's like my dad would send child support. So that put a huge gap between mine and his relationship. I was very insecure. I felt guilty for that. I was first introduced to drugs at about the age of 13. By the time I graduated, I was a full-on opiate addict. I had my first child at 19. It was completely unplanned. I had no idea what to do, but I just had this idea, like I didn't want my kids to have to go through the things that I went through. So I was going to get out with their mother, but I was still battling my addictions and my own insecurities. 22, I had my second child. My addictions just got worse at the period. There wasn't really a whole lot of outreach. It really wasn't the social norm, I guess, where I grew up at in rural Kentucky for dads to be very involved. So, my whole life, I just looked at like I was supposed to go to work, and that was it, because that's all I'd seen growing up. My wife, or my wife at that time, we didn't have a very good relationship, very toxic as well. I couldn't hold down a job. At about 25, I hit a rock bottom. My marriage had involved. I was an IV drug user, and I got my first felony at that time, and my kids went into emergency custody. At 28, I was released from jail. When I got released, tried to get visitation back with my kids. They were with my mom at the time, and we didn't have a very good relationship. So that was a huge distance there. I'd spent 3 years locked up, and I didn't have an opportunity to talk to them very much in there. And DCBS contacted me and tried to get me to give up my rights as their father. At that time, I worked a case plan with them, though, and was able to get my parental rights back, visitation back. But it wasn't long after that, there was really not a whole lot of support for dads at that time, and I still wasn't on my feet. I was still battling my addiction. I did get sober for a while, but shortly after I got my case plan work, I relapsed and caught my second felony. After that, I I really had a chance to look at myself, being locked up again. I had the chance to look at myself when I got out. There wasn't a whole lot of support for me as a dad out there at all. So when I got out of jail, I was able to get into stable housing. After that, I started trying to get more involved with my kids, talking to them and getting some visitation rights restored. I started getting involved with the churches around here and started doing a little bit more outreach. After I'd been sober for a little while, I was I had the opportunity to go to the through the KY Dad Academy. After going through the KY Dad Academy, it really opened my eyes a lot. It opened my eyes to myself as a father. I wasn't very engaging with my kids. I'd spent all this time thinking I just can't. I can't. I have to be there for my kids. I have to keep this relationship together for my kids. I don't want to do them any harm, but I wasn't engaging with them. I wasn't involved. I was just going to work, coming home, going to work. That was just my life, and my addiction. So I think I did them more harm than good. After this KY Dad Academy, I really took a hard look at that. I have to see two of my daughters now, and as their father, going out into the community, getting them in schools and everything like that. When you would go in there, people would just look at you like, "Where's mom?" So it's always been a struggle to really be involved in that way, I guess. I
Go ahead, Tyler. I didn't want to cut you off.
And I think like a key theme throughout my whole story, like in my darkest times, I always felt alone and isolated as a man and as a father. But since my recovery in KY Dads, I feel a sense of fatherhood and I brotherhood from that, and I feel empowered as a father, and it really gave me a desire to want to get out there and share my work with other fathers like me. I've been in contact during in my recovery with a lot of dads that have went through some of the same struggles as I have. And now that they're on the other side of it, they think, well, throughout my addictions and everything, I've burned too many bridges for me to ever recover from. And that's not, I really appreciate you all for letting me share and for this. It's really an opportunity for me to grow.
Yeah. Thank you, Tyler, for sharing those parts of your life that have been growth opportunities and some things that could be difficult to share. I did want to ask one question because I know you've heard him mention KY Dad a couple of times, and in our next segment, Ronnie's going to explain more about what that is in detail. But one question for you. I noted several systems that you interfaced with: child support, the justice system, and the penal system, and maybe a county, state, or federal institution. I don't know which one you were in. Social services, y'all heard him say DCBS. That's for us here in Kentucky. It's the Department for Community-Based Services. That's called Family Services sometimes in some other places across the nation. But it's the Social Services Office that deals with protection and permanency. What people say, the mean people that come take your children, right? That might be some of you on here, but that's what some folks call it. You interface with that system. You talked about interface with the education system in the schools, and you mentioned this. But when you walk in those places, Tyler, did you see yourself in the material on the wall as a father? Did you see a space that was designed to invite you in as a father?
No, absolutely not. Especially with my involvement with the DCBS offices. I went in there and it's kind of hard to say, but when I went in there, they just looked at me like I was doing my kids justice by for me just to sign my rights over, like I would be doing something good for them just to sign over my rights. There was really no outreach, no help or support there, and I have to say, with my view on child support growing up, like I said, I felt like it was tennis for my father, but in the child support office, they were really, really helpful with me. So my views on that was kind of obscure at first. But you know, they made it really easy for me to get my plan worked out, you know, and that's for my son, my youngest son. So, but as far as a safe space or anything, I didn't, you know, I really didn't have that, or with the schools either. Going in there, you know, as the father, you know, when I take them, when I got my kids back and took them to open house at the schools, you know, when you go in there, they just kind of look at you like, "Where's mom? What are you doing here? You know, where's mom at?" You know, in the same way with doctors' offices, you know, you kind of go in there and they just kind of look at you with this confused look of, well, why are you here? Like, you know, father, and you know, I'm involved.
Yeah. Thank you for that, Tyler. Thank you for sharing with us. Hang tight. We might bounce back to you. I ask those questions for those of us in the audience because first of all, let me tell you why. One reason I don't ask the question, or I ask the question not for this reason, and it's not to break down or tear down or to be divisive or to cast stones at our service systems. That's not why I'm asking the question. It is because we have to look at our service delivery systems and understand that perhaps they were instituted at a time or they're built at a time when we didn't have the full body of information of how important fathers are in lives of families. And I just want us to all to know that we have systems we need to examine to make sure that they are father inclusive. That's not a terrible thing as long as folks are willing to acknowledge that's a growth opportunity. And if we don't include fathers, next slide, please. Just some more validation on what father inclusion can help us do. So you heard of the abuse and neglect. They're 5 times more likely to face abuse and neglect if they're in a home absent of the father. Again, that's not an aspersion at mothers because we know who the majority of the time has primary custody, mom. And many times that's a good thing. But we also have to remember that there are opportunities for dad to be a custodian as well, or to at least be involved. Next slide. More on child family well-being from father presence. Two parent family homes have a neglect rate of only 4.29, whereas single parent or step families have a rate of 7 to 14. When a healthy father is there, he provides a sense of protection by protecting against outside threats, providing financial stability, teaching children to respect mom and others. This is a huge thing. Please know about fatherhood and fatherhood work. Fatherhood work is not the opposite of working with mothers. Fatherhood does not contradict motherhood. It complements motherhood. And it teaches children to help be competent. Next slide, please. Again, you heard Tyler talking about his history with addiction. And we mentioned that fatherhood helps with substance use disorder. And here are just some data from the National Fatherhood Institute that says children who face absent fathers are a higher risk of developing drug and alcohol addiction, as I mentioned. And children who have father figures, it leads a void in their life that they often seek to fill, and it affects their physical and mental ability to have healthy relationships. Next slide. Again, more information on substance use disorder. 75% of adolescent parents being treated in substance abuse centers come from father. That says fatherless. That's not a language I use. I'll tell you why. But they're 10 times more likely to abuse chemical substance. When the father's present, they're less likely to do so. Next slide, please. So again, I just wanted to share some things that were related to Tyler's story there that align with the things that father presence we know through research brings to bear. So now you heard Tyler say several times, talk about his experience with KY Dad, and I appreciate that. That's a program of the Commonwealth Center for Fathers and Families. So now Ronnie Williams, our communications and
David,
outreach.
David,
Yes,
if I can interrupt 1 second.
please.
We have a hand raised with a question, and I'm going to ask Romana to ask her his or her question.
It wasn't so much a question, but as a comment. I'm from LA County, and he said that, you know, they treated moms better because maybe that was something in the past, but it isn't. They're still discriminating against dads. I work as a parent partner. I'm always trying to reach out to dads to participate. And I've had several where I've really had to advocate and be by dad's side, because even though the mom wasn't ready to take custody, they were still trying and trying and trying, even though dad was there to step up to the plate. So that type of discrimination is still going on, you know. And when we consult with DCSF, what are your expectations? And you know, there's a mom and there's a dad. They might not be together, and you're going to say, I'm going to work with dad. They try to dissuade you from that. No, 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 you have to work with mom only. The case is open with mom, but why? You know, so if there's any peer advocates out there, or anybody that works with families, we also have to advocate to make sure that dads are included, because dads are a very important part of the family. And it's funny, it's not funny, but it's like they don't want to waste the time to look for dad. But if there's a dad in the prison system, those are immediately, you know, brought into court and everything, because they're easy to find, you know, but they don't
Thank you.
find them.
I think this is going to be a great conversation. So please hold that thought, because I want to hear more from you. But I'm going to return it back to David, and thank you so much for commenting. And don't not talk at the end of this presentation. Thank you.
Thank you so much, sister. That's affirmation. And we keep in mind, nothing is a monolith. Nothing happens everywhere all the time. But there are certain things that are sort of baked into our systems, right? And even the example the sister just gave us, I don't look down or look at with a bad intention of anyone. But when we've been in a system that has a pattern, we go with what's familiar. And our systems are maternally bent, our justice systems, our human service systems. So our systems need to make some adjustments. But in the work, we say this, before I kick it to Ronnie to tell about CCFF, I want folks to know this. Here's the philosophy we teach and the school of thought we try to get our men to adopt. There are two kinds of issues we deal with as fathers. We deal with self-induced issues. Tyler owns some of the things in his past, right, that he's been blessed to work through. He had some self-induced issues, but then he had to deal with some systemically induced issues. And those two together are quite a cocktail, right? And so the system that, and the example that was just mentioned, is probably a system that has generally looked to mothers. But we have to remember, as providers, practitioners, lived experience folks, that we have to do what's best for team, what we call team little, and the child. And the other piece is, we talk to fathers about owning their pieces of the self-induced, so that workers should, we fathers have to be in schools more often, right, Tyler? So they don't look at you like you've got three heads when a father walks in. Let's, as fathers, make it more standard for us to be in the spaces that mamas used to be in. Let's more fathers be in prenatal appointments. Let's more fathers be part of the PTA, right? And so it's not as odd to see. So thank you for that, sis. Brother Williams, would you tell us briefly about the services and the approaches that CCFF seeks to propagate?
Yes. Now you all can see a more handsome face, young face. Yeah, I've been talking to these old men all day. Could you advance the slide, David? So our 5 key pillars that we do is policy and advocacy, our KY Dad Academy, which you all have been hearing from Tyler and David himself, our annual Kentucky Fatherhood Summit, which we put on every year. And that is like one of our major hitters. We invite tons of different local, state, and national speakers and fatherhood advocates. Or our mini grants, which I'll talk more to in the next few slides, and professional development and trainings. We actually presented and trained and educated on the state, local, and national level also. And we're constantly doing those. Next slide. So our KY Dad Academy. So what CCFF seeks to do is to improve the child and family outcomes through positive fatherhood engagement. And so we're not a direct service, but this is one of our components that is the closest thing that we have to a direct service. And so it's a 6-week, 10-lesson fellowship. We pick dads across the whole state of Kentucky, and we try to pick a dad from different counties, each county to be different. Last year, we had a total of 13 dads from 13 different counties. This year, we actually have 15 dads from 13 different counties. And so what they do is they come on a Zoom call for 6 weeks, every Tuesday and Thursday from 6 to 7:30 p.m. And they get trained on how to become a better father, learning about the fundamentals of fatherhood, learning about policy and advocacy, mental and physical health, and just the importance of their role as a father in their children and families' lives. We want these fathers, once they commission from the program, the KY Dad Academy, we want them to become advocates and ambassadors for fatherhood and for CCFF. Lived experience is highly valued. Like I said, they do get a stipend of $100. So it'll be $100 a Tuesday and then $100 Thursday, which gives them a total of $200 for the week for 6 weeks. And so if you do the math, that's $1,200 for 6 weeks. And then at the commissioning, they get a add-on bonus of $500. And so you're getting paid to become a better father. It's a no-brainer if you ask me. And so there will be another cohort in the summer since this cohort is about to end. We do a fall and spring cohort that we just started this year. Next slide. So our mini grants. So with the KY Dads, what we hope and try to steer and empower our dads to do once they graduate from the KY Dad Academy, when we were talking about them becoming fatherhood ambassadors, after they graduate, we want them to be able to advocate for themselves and actually help and promote other fathers to want to be these fatherhood ambassadors. And so they can take advantage of our mini grant program, which are just small grants that we would give them to do and host like father-centric activities or events, community-based events from wherever county they're from. And so it's 2 different levels. They range from 5,000, the first level, and then 10,000 to the other level. And so that application window closed March 22nd, and the new window opened up this summer. And so we also,
Ronnie?
yes,
Ronnie, I'm sorry to interrupt, but they're asking, do you have to live in Kentucky for this opportunity?
yes, you have to live in the state of Kentucky. So we are statewide.
Thank you.
No problem. And so we have a total of 48 total counters combined with our mini grants and KY Dads over the years that we impacted. If I'm not mistaken, it's 120 counties in Kentucky. So we're halfway covering the state of Kentucky with KY Dads and mini grants, just our reach. Next slide. Okay.
Thank you. Thank you for that, Ronnie, for sharing CCFF's information. And to the individual that asked if in Kentucky, yes, and that's intentional. Our funding currently only allows us to serve that program in Kentucky. So again, that's a 6-week, 10-session training intensive. And it's not diapers and Similac. It's more personal and professional development. And so the facilitators that we bring in are no small fries. They're going to hear from research professionals from University of Kentucky, University of Louisville. They're hearing from licensed therapists. They're hearing from financial literacy professionals and financial or MBAs around their finances. They're hearing from family specialists on co-parenting in those sessions. So it's a professional and personal development so they can become ambassadors. And so that program, we pay them that stipend, which is fairly significant because we want to, again, first of all, raise the bar for fatherhood and also raise the bar for lived experiences. And so we were able to do that. And so we want to make certain, and the mini grants are capacity building mini grants. They're not just for the KY dads, but our philosophy and vision here in Kentucky is to do the KY dads in the various counties. We're from Kentucky. We go by counties. A lot of places don't do that, but we go by counties a lot here. We want to raise the number of programs and projects in the counties. And our hope is that there will be intersection between the mini grant locations and the KY dads will come together, and we eventually want to raise up full service programs. And so before I go to Teray, who, despite Ronnie's comments earlier about the old men talking, Teray is actually younger than Ronnie. And let me teach the young man a lesson here, and anyone else on the call. Never talk bad about the person that has the microphone after you. You lose every time, brother. And so I get the microphone last. So Ronnie, I'll have some choice comments for you. So, but moving ahead, you all, wanted to make sure that, again, you not only heard the clinical and programmatic elements, that you heard the practical elements. So Brother Teray Wilson is another KY Dad alum. Please excuse that city reference. He's actually from Lawrenceburg, Kentucky, and that's my mistake. So my apologies, Teray. But if you take a moment and share with us and those on the call a little bit about your narrative, how it has intersected, how you have been able to overcome some barriers yourself.
Hello, everybody. So I just want to first start off by saying thank you for taking your time today, talk with us, share our stories, and a little about what KY Dad and CCFF and NFF are all about. So as he said, my name's Teray. I'm 22 years old. I'm a father of one, and he's 1 year old. But just a little bit about myself. Growing up, very early on growing up, my dad was, I wouldn't say the best role model or person that you would be proud of to have your father. We had some good memories, we had some bad memories, but they're all very early in my life. They could range from being on top of his shoulders while we walked to the candy store to get some candy, but that very next day, I may come home from school seeing the house in rambles, my mother distraught. And at the time, I didn't really know how to process that because I was still only about 3 to 5 years old. But I remember one day there was a conversation I had with him. It's probably about 5, 6. I may have seen it from a scene in a movie or something, but I looked at him and I said, you know, when I grow up, I want to be just like you. And at first he gave me a puzzled look because I feel like he knew the type of man he was. But in a stern tone, he told me, no, you must be better than me. So as I grew up, and as he was in and out of the correction system and slowly drifting out of my life, because what it seemed like to me, he cared more about his street cred and how he was doing on the streets than the family he had at home. I grew up, we moved to Berea, me and my mother, and this is where she met my stepdad, who I'm still thankful to this day, who I consider to be my real father. And I'm lucky enough to be in that position from a single mother to not grow up my whole life as one. So that really helped me as far as my schooling and the things that were important to me when it came to academics and being a pillar in my community. So I went to a school that I was the only Black kid, but with that, what I'm getting to that is that made sure that I wanted to make sure I excelled in everything I did. So I was on the student council. I was on part of all the teams. Had good grades in school, but all that in the back of my mind, I feel like it stemmed from, I'm going to do this all without you, Dad. So once I do get to school, into college, my mental health started very go downhill, started to deteriorate. And I didn't take the proper steps to take care of it. Started getting involved with the wrong crowd that was in my hometown because all my other friends had moved away to go to school. But through a combination of that and not having my priorities where it was, I had a mental fallback where I had a mental health crisis. I ended up going to a psych ward at UK hospital to address that. But coming out of that, moved back in my mom's, felt like everything I had worked towards in my life just was all for nothing. Felt like a failure, but I picked up a job at a hotel in my hometown, Berea. And from there, I just kind of still lived life as nothing really mattered to me. Just going out, partying, drinking, day in, day night, not really thinking there was anything else in the future for me. And at that time, as far as my relationship with other women, I wasn't really looking for anything serious. I was just kind of being young and dumb. So I met a woman, a beautiful woman who I'm still with today, mother of my child, on a dating app, which is where most of my generation meets a lot of people nowadays. But she knew at the time I wasn't looking for anything serious per se, and that we still did things that couples would do. We talked about our future, went out to zoos, many dates, and I always knew in the back of my head that this woman was somebody different, somebody special. But 2 months in to what you call a situationship, I guess, I get off from work and she gives me a call. She's crying. I'm trying to understand what's going on. She wouldn't tell me. And she sends me a text of a positive pregnancy test. And my heart dropped. At the time, I was 19 years old. All the thoughts started rushing in my head like, I haven't got my life together. What am I doing? I was going to end up just like my dad, yada, yada. And at that time, my stepfather, who was incarcerated at the time, he came out of jail. And this was all in like a week span. But I told him that night I found out, I need to have a conversation with him and my mom. And he said as a joke, like, you didn't get some girl pregnant, did you? But we kind of had that look at each other. He said, oh man. But I think a good important thing during that time, him and my mother, both of them, they didn't make me feel ridiculed any type of way. They were supportive. My mother had me at a very similar age as well, 21. So she had that lived experience, and I'm thankful for that because I could go to her about anything I needed. As far as preparation into all this, my girlfriend now, but at the time we were still not together, didn't get together for the baby. I still think I would still be with her today, baby or not, but I'm grateful to have that relationship with her during that time as well. But it was still a point that I'm still 20 years old. I didn't really have a dad. I didn't know what to do. So after he was born, fortunately, he was premature. He was born at 33 weeks and 6 days. So he had to stay in the NICU for a while, and that was really hard on me because I lived in Berea at the time, which is about a 40-minute drive from the UK hospital that he was staying at. So for a good 2 weeks, I was going to work if I could, and then going back up there day in, day night, just checking on him, make sure everything's okay. And I'm blessed this day. There's nothing wrong with him. Everything turned out great. And he actually got to come home on Valentine's Day, which I thought was pretty nice. But at that time, we were living in an apartment in Berea. I was the only one working, just so she could stay home with the baby because my mom's still working. We didn't really have anybody at the time to watch him. But we quickly started to realize money situation, it just was too much being in a family with just one point of income. So her own grandmother actually opened up her home to us. I want to say he was about 3 months old at that time. I've always been the person, though, that I hate asking for help. And I kind of get too stuck in my pride of doing stuff on my own. But I knew what was best for our family, so we moved to Lawrenceburg with her. Now, at this point, I don't have a job at the time. We're all living in one guest room together. But that's where the support that I have and my mother, my grandmother, stepfather. My grandmother actually sent me a flyer for the KY Dad Academy and what they were doing. And at that time, it was such a help for me because I got to learn so many things that I never even dreamed of would come up as being a father. Through is what Ronnie was talking about before. Mainly what helped me was the financial stability portion that we talked about. Really helped me a lot to this day. And the resources they provided us with, as far as talking to some of the guests that we had, and after, I still stayed in contact with David and his other colleagues, and helped me find a job as being a front office manager now at a hotel, which is just that one step that I'm taking forward to hopefully get my own hotel one day. And I now have a life coach as well, which has been very helpful to me and figuring out what I want to do with my life. And I guess that's it. That's my story, and I hope some of you all could relate to that.
Thank you, Teray. That's a phenomenal story. And it's a story that many would be to see a young man. Next slide, please. A young man like Teray. You will recall earlier, you all, that I mentioned the percentages of father absent homes and the percentage in the African-American community allegedly much higher. Well, we were actually learning through research here that now we know that Black fathers are not more likely to be gone from their home any more than their peers. In fact, African-American fathers or 70% were most likely to have bathed, dressed, diapered, and did those not menial duties with their children than their peers, as compared to 60% of Hispanic, 45% of their white counterparts, and that African-American fathers are more likely to do homework or read to their children than their peers, right? So there is a little bit of a myth there. Next slide, please. I will tell you that the way the data is collected and some of the cultural idiosyncrasies within the community, if fathers are not in the home physically, they will be counted as absent. And there are many cultures and in many communities where fathers are interacting in a meaningful way, but are not a resident cohabitating in that home. So that skews the data. Also in fatherhood, there's this phenomena of present but absent. And you're going to see that more in the white collar community, where fathers may be at a corporate job where they have to be in New York for part of the week and then back home in Maryland the other part, and there's really not that quality time. And so we hope you're also getting here to see that while Tyler and Teray are very different, Teray doesn't have a beard, Tyler does, right? That's the main difference. They're very different, yet they're dealing with similar issues, right? We heard in Teray's story, again, that father note of pre and perinatal outcomes that fathers being there can be very helpful. We see in his story the interface with the healthcare system. We see in his story the way he was as a child. Teray, let me just ask you this. Don't let me use conjecture here, Teray. You mentioned your biological father and your stepfather. Tell me more about how you reconcile that and how you deal with that and how that plays into your fatherhood.
Are you asking in a sense of how I compare the two?
Yeah, how does just how do you kind of reconcile that in your mind? Do you have two fathers? How do you handle that? I mean, there are many blended families that people on here are dealing with, I'm sure. So
How I would put it is, I think no matter what, a young man, young boy, grown man, old man, they're always going to want to have that relationship with their dad that they wish they could have. But at the same time, I've kind of accepted the fact that it's probably it's far past that point where we can reconcile our relationship, because I'm always going to have in the back of my mind, like, okay, well, this is what you did in my developmental years. Why are you wanting to come back now? Like a big thing with him, my biological dad, that stuck with me was when my son was born. I believe he got out of prison 2 months after, and instead of coming to me saying sorry for what he did, he was more excited about the fact that he had a new grandchild that he felt like he could just start over. And in my mind, that's not how that works. That's not how that works at all. Especially if your grandchild is your son's father. Of course, it'll be your son's father, but that whole relationship needs to be solved at the foundation, which is that relationship between me and him. And that's something that stuck with me. And in the contrast, my own stepfather. One of the things he told me, there's no blood that can make us any closer. And I do truly believe that, because all the lessons in life that a man should know, I got everything from him.
Well, we've got about 4 minutes left before we have to turn it back over. I will tell you all that it's the first time I've heard this from my colleague, Teray, and he and I have a conversation to have. But you are watching unfold live and in persons the layers of father wounds, you all. Thank you for sharing that, Teray. But this is the multi-layers to it. And there are people on here that are either lived experience people, or they're providers even, or practitioners or researchers. I don't know who else on here. But you're dealing with your own father wounds. And when you're dealing with your own father wounds, you have to at least be aware and conscious of those as you're seeking to move forward in life as a parent or a worker or a researcher, whatever you're doing. Teray, I will say to you that it's normal for when the grandbaby comes, the grandparents don't care no more about the kids. My son gave me grandbabies, and I don't mess with him no more. It's the grandchildren I immediately give priority. But the interesting thing is that you never really felt what you needed to from your father. But him skipping over you to get to that beautiful grandbaby, that's pretty natural. Where the disconnect is that you have unfinished business. So I'm going to push back to tell you that it's irreconcilable. It's just not going to be easy. All right? We'll talk more about that. Next slide, please. So again, those pre and perinatal outcomes, 70% of adults say it's equally important for a newborn to spend time bonding with their father as it is their mother. We say, oh, that mother needs to be with that baby early on, try to breastfeed. All that is wonderful, but we know skin to skin and things like that are very helpful for the father and the child's development as well. Next slide. And you heard Teray talking about how he has worked for employment, how he had to move and navigate things, to be able to be eligible or to be able to have housing with family and extended family. And what he didn't mention is there are public assistances and things that he's had to take advantage or had to avail of, which is fine, he and his mother of child. But father absence, there is a cost to society for that as well. And so we just talk about the increase in that cost of society over the years as father absence has been there. Next slide. And as we conclude and kind of give it back to our moderators at NFF and NFSTAC, I wanted to just make sure you know that as we deliver services here at CCFF, and as we talk about promising practices and approaches here at CCFF, and as we talk with men at KY Dad, and as we do policy and advocacy for fathers, though we talk about the father, we're actually a children's program via the father. I care deeply about these fellas here. We'll grow to care more deeply about them, but I care more about, just like your biological father, I'm more concerned about the outcome of your son, Teray, and the 6 children you steward, Tyler. But I know by making you better, we know by buttressing you that we're also creating an environment that is better for your children. So moving ahead as providers, as parents, as all those on this call, keep the main thing, and that's the babies. And so with that in mind, that's kind of what we do here, a snapshot of it. And we'll kick it back to you, Sister Gail.
Thank you. This has been a fabulous presentation. I really appreciate it. And we have lots of questions, David, for you and your team. First up, Ashley Pina. I know you've had your hand up for a long time. If you could put your camera on, if you feel comfortable, and take your mic off. The question is all, the floor is yours. Please.
Awesome. Yeah, thanks everyone. This has been a really great presentation. My name is Ashley Pina, and I work for the Division of Behavioral Health and Recovery in Washington State for the Healthcare Authority. My role is Pregnant and Parenting Family Substance Use Disorder Policy Administrator. And a central aspect of my role was to develop a family preservation model, inclusive of fathers, of course. The model is implemented across the SUD treatment continuum of care. And I actually have a question for Tyler. I'm wondering if you could tell me and the audience, throughout your recovery process, were you provided with treatment services such as parenting skill training or trauma-informed care specific to your role as a father navigating a substance use disorder? If yes, can you please describe those services and or experiences? And if not, what would you have benefited from?
I wasn't involved in anything like that. The closest thing that I could think of while I was in jail, while I was incarcerated, was they called it AA where I was at, but you would go in, and it was through a program around here called Windows of Discovery. They would send someone out, and they would just kind of talk to you a little bit about, maybe taking parenting classes or something like that. And that's about as far as it went. They didn't really leave you with any option to follow up with that or anything. But that was really, I never went to rehab or anything like that. After I got clean, I done it on my own. I could have benefited from so many of the things that I learned from the KY Dad program, being intentional about being a father, the co-parenting, being intentional about my mental and spiritual and physical health. I never really took that into concern either, but if I would have had this program, and I'm not just, I am bragging on Kentucky Dads. I love that program. It gave me a safe space to voice my opinions and voice my concerns as a father. After not having my kids for so long, I didn't know how to be a dad. But the majority of the time that I was a father, I was an addict. I was there changing diapers and things like that, but I wasn't an intentional father. I didn't know how to, I didn't know how to raise teenage kids. And so I was just kind of thrown right in the middle of it, and it was scary, but through the KY Dad program, we talked about those things, talked about those concerns, and they helped me work through a lot of stuff there.
Thank you so much.
Okay, does anyone else have a question? A lot of folks are asking how they can do this in their state. And I put in the chat that everyone should visit their affiliate. If you visit the Federation of Families, the National Federation of Families website, under affiliates, you'll see a map. And this is in the chat. The link is in the chat. And in the map, it's a map of the United States, and you can find a Federation of Families affiliate in your state. And you can always ask them, for where is the closest fatherhood program. And in many cases, it's one of our affiliates that's hosting it, or they can navigate you to the appropriate channels in your state. I'm also getting a question from Amy that asks, what kind of programs and activities do the mini grants support? And I guess, would that be Ronnie? Would you answer that question?
Yes. So any community events that are sort of father-centric, or just bringing the community together, family-oriented events in a community and that sort of deal.
Yeah. So let me supplement that if I could, Ronnie, and Gail. So we call them capacity building mini grants, because in this state, we're still trying to, if we were building a fire, we got the wood and we got we got some good dry wood, we believe by now, through the work we've done over some time, and we got some pretty good kindling. And so those capacity building grants, it's kind of striking the match to get the fire burning, right? So they're $5,000 to $10,000, and they can be events. So, and I don't like one hitter quitter events unless that event has an objective to build ahead to a larger service program or build some momentum. So these capacity building grants are for events in the local programs out across the state. That's the first tier, just event-oriented Father's Day event, and it has to have a fatherhood awareness component to it, right? So where you hear of Donuts with Dad, you hear Father's Day event. So that 5,000 lower levels for that. The second tier is 10,000. That 10,000 has to have some curricula or battery of services in that grant. So they have to deliver a nurturing parent, a 24/7 dad. They have to do all pro dad. They have to do some financial literacy along with an event, so they get more resource for that. We're going to introduce a third tier that you have to do events, you have to do a battery of services and or curricula, and you have to partner with an agency, an anchor agency that could help sustain the program, such as family court, drug court, child protective services, child support, schools, family resource center coordinators, all elements of which you have in whatever community you are. And so Ronnie was right. Yes, there are events in communities, but we are very intentional about working with communities and agencies that have the capacity to collaborate so that they can build something more substantive than we can support in the mini grant. So it's kind of a pump primer, right? And I'm a little old, since Ronnie reminded me how old I am. But in the country, you used to have to prime a pump when you're getting water from a well. And so we're trying to prime the pump with these mini grants, okay?
Any other thoughts or comments? It doesn't have to be a question. I'd love to hear from the audience.
And actually, I would like to open it up to some of the men on the phone if we wanted to speak to some of the stories, or even share, ask questions or share your experience as a father.
And I see Cheryl has her hand up, so we'll
Okay.
call in Cheryl. And dads, the men in the audience, please get ready with your thoughts after Cheryl. Cheryl.
I apologize. I work in a school, and as soon as I logged on, I had kids in my room, so I missed all of the presentation. Is there a way to listen to this, and you probably have said this multiple times, as a recording?
Absolutely. Give us about 7 days and it will be up on our website. Also, all PowerPoints, slides, and the video with the link will be sent to you in your email if you have registered.
Fantastic. Thank you so much. I appreciate it.
Sister Gail, I'm seeing in the chat that several folks are asking about KY dads. So that's branded for Kentucky. But there could be an Ohio dads, an OH dads. There could be an NY dads. There could be a London dads. You know, and that dad for us is dedication and devotion because we feel like dads are dedicated and devoted, and there are dads here in Kentucky. So it's really not rocket science. The sort of the infrastructure behind that. The primary piece are the resources and is putting together the infrastructure to the administration for it. And so I'm glad to, I could say, share the model or approach or coach people up on that as appropriate. But it's really that's why you've seen fellowships, fellowships with like Robert Wood Johnson, or fellowships where you get cohorts of people and you get a battery of information. And after the completion of that, you know, you become like this group. You've seen in some of your areas like we have a lot of chambers of commerce have things called Leadership New York or Leadership Manchester, where they bring together folks that they want to equip to be leaders. Well, this is just a fellowship for fathers, right? So you've seen fellowship and group models. We do that. We were able to, with our funding sources, which are here for us, our state and local, to say we're allocating a certain amount of resources that will go directly to fathers. And we're able to, and with the, and we're only in our third cohort. So we work with about 50 men so far. So please don't let us overpromise and to make you think that we've got some sort of magic pill. But to this point, it's been very useful. Let me just tell you let me just call our baby ugly, which you have to be able to do sometimes to progress, you all. Teray and Tyler are from 2 different cohorts. Each cohort has had 13 to 20 men. You're going to bat about 50% on those that remain after the dollars are gone. Let me be completely forthright with that, right? That incentive we give them or for their time is a big draw. And people say, oh yeah, I'm going to stick with this and we're going to keep going. But all do not. You're looking at the creme de la creme here. So I don't want you to think that, oh, all 15 men are engaged this deeply and are moving that. I don't play that game because the price is too high. The price is family, and literally the price is life at some point. So if you're looking to do some things we're doing, we've got some bright spots, you're looking at them. But if you ask me about it, I will tell you also the growth opportunities.
And thank you, David, for being transparent like that. We have a question from Melissa and then one from Jenny, and I'd like to hear from the men too. So Melissa, you're up.
Fellas, they're begging us. We can't say nothing about not having a space if we don't say something while they're begging us now. Don't make it hard on me.
Go ahead, Melissa.
Hi, my name is Lisa Hanley, and I work as a family support worker in Oregon. And the situation here is the vast majority of people that work in my capacity are women, and there is very much a lag of men being involved in either doing the parent education or parent support roles. And so I'm just sort of wondering, from the perspective of the gentlemen that have gone through your program, what's the experience like getting trainings from a woman, and then from David, how how do you go about building, do you have any ideas of how we go about building a system where there's more men doing this kind of work? Thank you.
Thanks, Melissa.
Thank you. I think I heard the first part too. Your voice was pretty low, but I think you were asking, and I've been corrected, Tyler and Teray are from the same cohort. But gentlemen, are there any women presenters that y'all recall from our cohort? I think that was part of the question.
Yeah.
The receptivity of men to the women, at least in our program.
Yeah, there was a couple presenters throughout ours that were women. We've done one on co-parenting, and then I think one on mental health. Both were presented by, and you know, they were great. That was actually one of my favorite one of my favorite presentations was one about the mental health and the co-parenting class. So, you know, the information was there, and it was a really involved and engaging class. So I really enjoyed it.
And
Yeah.
I think part of the question was how, because there is, and I know this, I was the executive director of the family run organization in North Carolina, and my staff over the 14 years I was there, we had many, many females with lived experiences as family peer specialists, but I think we only had 2 men who worked for me as a family peer specialist over the 14 years. So I think part of the question was, how do men feel about getting their training from women in general? And I think you just answered some of it, but does anyone else have any thoughts on that?
So yeah, and yes, Gail, and I heard the sisters, the end of the question being, how can we get more men engaged? So listen, I'll answer it in this way, because I hear you all, you know, even in this space saying, men, you know, come in. But you need to understand, you all understand the phenomena of lived experiences not wanting to approach some of our systems because our systems have not always been user friendly and have not always been, you know, about trust issues among lived experience folks with systems, period. So translate that to fathers who have been in an environment where the services were not tailored or towards them, and not even not tailored, but may not even consider them. And we've heard about those experiences. So to get men engaged, there's still got to be some building of some trust there. No different than anyone with lived experience working with the system. We've heard that men have receptivity to women, but I think it has to be in a context of a program that we know is offered for fathers. So they didn't go somewhere to get, they didn't go somewhere that was a traditionally parent-centric service that happened to have fatherhood stuff. They came to a fatherhood program that had women working within it. So see what I'm saying? There's a subtle but significant difference.
It makes a great point.
Yeah, there's a neighborhood here, Gail, that I live in near, and it's a high Spanish-speaking population. I love going there to get the pollo, right? And I go to this, in that Spanish-speaking neighborhood, there is a Chinese restaurant that has chicken wings. I love wings, right? Little wings, little blue cheese. But if I want wings, I don't go to a Spanish-speaking neighborhood with a Chinese restaurant that happens to have wings. I go to Buffalo Wild Wings. I go to Wing Kings. See, that's the difference, right? Wings don't happen to be on the menu. Wings is what they do, right?
Exactly, exactly.
So
I
fathers
think
don't happen to be on our menu. Fathers is what we do. And so that opens up hearts, right? To receptivity to whoever's in BW3s serving those wings, right? So I think that's the difference. We have to move from a maternal-centric system without neglecting moms.
What are your thoughts on bouncing? I love bouncing. I don't know how people don't know about this.
Someone loves bouncing. Mute buttons are dangerous.
Well,
but anyway,
David,
I don't want to go on.
We
But
have
yeah,
two
I
more
know.
questions and we're running out of time. So we're gonna go with Jenny and then Efrain, you were gonna be our last question. Go ahead, Jenny.
Hi, so this topic was actually a perfect segue for my question. So I am a family support provider embedded in a community mental health organization. And one of my goals over the last 2 years has actually been to increase participation and welcoming fathers into our organization. So, and I know that our organization and many others like ours has more of that maternal lens. And I'm just kind of curious, like, what are those specific things that you can think of that we can do to help make our organizations more father friendly? And I'm looking for concrete examples. Like I loved, I think it was Tyler that had mentioned not seeing himself reflected in the literature in a room. And I love that gives me a direction to go in to make sure that all families are represented in our literature and in our brochures and pamphlets and things like that. But what other concrete things can you think of that can be helpful?
Do either of you fellas want to try that? I obviously I have some things that I would say, but gentlemen. So here's what I will say to you. Just a space where just like anybody of any culture or anything else, they want to see themselves in the employment, in the employers, in the space, those concrete things, but also in your philosophies, there are some things that you need to look at in your policies and procedures, right? And so when you do an intake and you do an intake with a mother, do you, I'll stop short of saying mandate, but do you ask them, where is dad? Not just once and check it and move on. Because we have lived experience mothers that said, I intentionally did, I told them, I don't know where dad is. And I absolutely knew where he was. Do you have a early paternity establishment registries? But here's something I'll leave with you, Sister Wilson. There is a father readiness network assessment or father readiness assessment that you can take. It's from the National Fatherhood Initiative. You can go online to their NFI, and it for any agency, it looks at 4 quadrants, and it will look at your father readiness, and it will give you feedback on, based on how you answer honestly, how you will score on the respective quadrants of father readiness, which are your leadership development, your organizational development, your program development, and your community engagement. And in those 4 quadrants, it will tell you, hey, you could do better here. You're hitting the mark there. It looks like somebody put it up there. Yeah.
I noticed that. I'm going to say thank you.
We have very, very quick staff here. Thank you, Dana. If you look in the chat, you will find the link. And I think that readiness assessment is a great tool. Thank you, David, for suggesting that. Okay, our last question. You're up, Efren. Is that how you pronounce your name?
Efrain? Yeah, can you hear me? Can you hear me?
Yes,
Okay?
very
All right,
well.
yeah, I was just, listening in, and you asked about, some male engagement, and I wanted to just participate. I think it's important. I just thank you for the space and for having these important conversations that are happening, thankfully, all throughout, our country. So I am in California, Orange County. I am a fatherhood engagement specialist here for a perinatal support for mothers, but we want to include more fathers, and we are doing a lot of things to do that, including changing our logo, changing our colors, changing our policies around that, the way that the space kind of looks, and I'm kind of like the man that's like, hey, let's try this, let's try that, think about this. And I think that, they're all saying that those are important steps to having because there's individual change, but this is more of like a systemic change, right? That needs to be happening within clinics, within schools, within, all these public establishments. So, the work that's being done here is amazing. I guess my question, or just something that comes up a lot for me. I work with a lot of new dads that are going to become fathers, and the financial topic is a big hot one. I love that you guys have like a person that comes and has, you know, more expertise on that. I would love if you can share a little bit more about that, what type of if you know the topics that are shared, or maybe if there's any websites that I can, you know, tune into for more financial support, so I can provide for my clients.
Yeah. Thank you, Ephraim. I'll just real quick throw at that. First of all, there are a lot of folks doing daddy doulas. That's a neat project that's going on. I'll actually be out LA next week at Dr. Rodriguez's 25th International Father and Families Coalition Conference. So there's a resource out in LA. I know y'all are huge out there. Reference to financial literacy, there's a plethora out there, but I would tell you that your banks and financial institutions in your city have Community Reinvestment Act dollars, and they're required to do interface with the community, community engagement, and probably any bank, any town, USA, that's somewhere in their charter to do community reinvestment and engagement, and doing financial literacy with nonprofits in certain niche and marginalized populations qualifies for that. So you could say, hey, Bank One, Central Bank, Farmers Bank, whatever bank, USA, we have a program, we have a ready audience. We need some financial literacy. We need some budgeting. We need some retirement investment. We need living wills. They're supposed to do all that stuff for banks and attorneys. That's in their sort of Hippocratic oath and charters to have to do. So that's a place to start, you know. We use a lot of faith institutions, churches, mosques, and temples, faith-based organizations. There are people in there that are volunteering to do those things as well. The individual you use happens to be from a faith-based organization that we enlisted to do here.
Yeah, thank you. And insurance companies have the same mandate. So you can get a lot of free services out of insurance companies and banks and attorneys if you're a nonprofit. So please always use those. I want to thank everyone today. This was fabulous. And I hope that we can continue this conversation. I want to point out a few things. If you could give back to the Commonwealth Center for Fathers and Families, here's their QR code. Also, coming up very shortly in the next week or so, we have a couple of big events happening. One is on May 9th, and it's Speak Up, Person-Centered Language Drives Equity for Individuals with Mental Health and Substance Use Challenges. That link is in the chat at the moment. And of course, more recently, next week on April 23rd, is Equity in Mental Health and Substance Use, Overcoming Challenges to Access for Families. Always, we have webinars once a month, every month from September to June, except next month is Mental Health Acceptance Month, and we have a very special set of webinars every Wednesday next month, starting with May 1st. We have Words Matter Wednesdays. And on May 1st, we're so excited that our principal investigator and the executive director of National Federation of Families will be speaking for us and talking about what words help and hurt families that we're supporting. For the 5 Wednesdays, we'll have families on the first one, and then we have the Aging Center of Excellence, the LGBTQ Center of Excellence, the Asian Pacific Center of Excellence, and the, I'm forgetting one. African American Center of Excellence. And they will all be having their month, having their week to present. It's going to be a very excellent, I'm looking forward to that myself. Now, I have asked you at the beginning, and I will always ask you, the way Samson knows we're doing a good job And the way we know we're doing a good job is for you to fill out the survey that's attached to this webinar. As you exit, there'll be a SAMHSA survey. Let us know how we're doing so we can make even bigger and better improvements. Tell us what you like and also tell us what you didn't like. We appreciate the helpful advice. So as you leave, you'll be asked to fill out this survey. And once you fill out the survey, you will get a certificate of completion. As I said at the beginning of the hour, we do not offer CEUs, but we do give a certificate of completion once the survey is filled out. And I just want to thank everyone. I want to thank David and Tyler and Tyree and Ronnie. You guys were absolutely awesome. Thank you so much. And we hope to see you next month. Bye, everyone. I'll leave the webinar open for a couple of minutes just so you can exit on your own. That way you can fill out the survey and it's easier.
I can't find it. You said you put it on the chat? Hello?
Actually, when you press the leave button, it'll take you right to the survey. So exit out and you'll see something pop up and it'll say, would you like to take this survey? And please say yes.
Okay, thank you.
And guys, you can feel free to hop off the call and we will hear back from you in our follow-up debriefing. Yeah.
Also in the chat is the link to the survey if you want to do it a different way.
And I mean the presenters, you guys can feel free to hop off the call.
Yes.
We'll see you in debrief. Excellent job, guys. If you can, at this time, exit out on your own and follow the instructions to the survey, we'd appreciate it.
Hi, I went ahead and did the survey. It did not lead me to the certificate though. I'm on my phone today.
Oh, okay. Lachelle, I'm going to turn that question over to you.
You can send an email to the Eventbrite. I'm not sure how that looks on your phone, but usually it should pop up. It should redirect you to download the certificate. If that did not happen for you, just send an email to the Eventbrite and I'll take care of it for you.
Okay. Yeah, I've had this happen once before. So, okay, I will do that. Thank you.
Thank you.
If you exit on your own at this time, you'll be taken to a survey. And once you fill out that survey, another pop-up should come up with your certificate of attendance, and you need to download that and put your name in it. I will keep this Zoom open for 3 more minutes. So if you could leave on your own, I'd appreciate it. That way you can fill out the survey easier. This Zoom will be closing in 2 minutes, so if you could exit on your own, we'd appreciate it.
Okay, Gail and Dana, I'm gonna end the webinar for us all. Okay, all righty.